Dr. Angelique Coetzee. She's the national chairperson of the South African Medical Association. She's also part of the team that discovered the new COVID-19 variant. Dr. Coetzee, thank you so much for joining us. In the last few weeks, we've definitely seen a massive rise in infections in South Africa, but the symptoms don't really seem as severe as we had in the third wave. What are you seeing and hearing among the medical community in the country?
Good morning, and just before I start, I just want to convey our condolences from the South African Medical Association to Kentucky and the governor of Kentucky and the people who is severely hit by the tornado last night. To come back to your question, I think there's a problem between what the scientists are seeing in the labs and what we are seeing at ground level. We had said right from the beginning that this is mild cases, and everyone were telling us we have to wait and see what's going to happen. So we are waiting and see what's happening. And this is now the 4th week, and still we don't see severely ill patients. There is a slight increase in some of the public sector hospitals with COVID pneumonia, but there have been no confirmed cases of Omicron death. I think it's important to state that. There was deaths, but whether it's related to Omicron, no one can say to us. And again, the symptom stays mild. Yes, it's a fast-spreading virus, but it's mild. It's not severe.
Well, that's something that I wanted to touch on. What is the rate of infection in South Africa at the moment? Because the UK is seeing numbers that experts there say could be the worst the country's ever seen. So how infectious really is Omicron?
Omicron is quite fast spreading, but if you look at the curve that we currently, that's currently being drawn by our modelers, we have not been near the height of the curve or the top of the curve of Delta. It is not as Delta. It's not as severe as Delta. It might be fast spreading, but the cases is still mild. So I'm not sure whether the people or these increase in cases that you have reported in other countries, whether they are admitting each and every one testing positive, but in South Africa, we don't do that. We only admit severely ill patients. And I can tell you, 99% of patients are mild. Within 5 days, they are, they're symptom-free. They're fine. They can carry on with their lives. And this is quite a bit of a difficulty in that we want them to quarantine and isolate for 10 days. Mild cases, I'm sorry, I know on paper it seems as if this is a terrible virus, but we need to take the clinical picture because the patient sitting in front of you is telling you the truth. That's where the truth is lying. What do you see at ground level? This is what we see at ground level. We don't see severe cases.
Dr. Coetzee, since the discovery or the identification of this variant, we've seen these massive travel bans with regards to South Africa and several of the other Southern African nations being imposed by much of the world. Do you think there's been an overreaction? Do you think that many countries in Europe are now panicking over something where, as you've said, we've known now for 4 weeks about Omicron and the symptoms don't seem as severe as Delta?
I fully agree. I think that was a total knee-jerk reaction. Yes, I do understand, again, that on paper, the virus looks terrible. More than 30 mutations escape vaccine immunity. And I can just imagine how scared the first world countries were when they got this data. But our scientists were clear right from the start. We don't have all the facts in place. And again, if you go back to all of my earlier interviews, you would see I have the whole time cautioned and say, this is a mild disease. We do not know what's going to happen at hospital level, but we are now in our 4th week, and we haven't seen the severe cytokine storm that you saw with Delta. Delta is a total different ballgame. That's a very, very dangerous variant. But Omicron, no.
Dr. Angelique Coetzee, live to us there from Pretoria. Really appreciate your expertise and your time this Sunday morning. Thank you so much.